going to go through really quick here all the layers of a cesarean. So when you have that, so it's a little anatomy of a cesarean. So
Okay.
we've got our skin here.
Okay.
And then they go through a layer of fat.
Okay.
Then we have our fascia. Okay. And right now these are showing a horizontal cut. I often see that horizontal cut right above the pubic, like bikini line area.
Yes.
I think I've maybe seen one or two that are the kind of up and down, but I definitely see this,
I agree.
Horizontal one a lot more often. Then they move. They don't necessarily cut. They just move the abdominal muscles out of the way. So they open that up. Then you have your peritoneum, which is a thin layer of tissue.
Going deeper and deeper.
Yeah, keep going deeper. Then they're going to move the bladder down a little bit. And then they make another horizontal, cut into the uterus or incision. And then they'll have to cut the amniotic sac. And then that's when they'll bring the baby out. Yeah. So it's depending on if this was scheduled or if this was an emergency C-section, that can also have an impact on your tissues and your recovery. So
many layers. There's so many layers. So how long really is the healing process from your perspective, from a PT's perspective?
Yeah. So the tissues those tissues that are cut will never get to their full integrity or return to that full integrity. But about a year, there'll be about 75%, which is pretty close to where they're going to be at. So, but it can take, we give those first 6 weeks for just some tissue, but up to those 12 weeks after, we're still taking it pretty easy after cesarean. Oftentimes you'll be limited to only lifting the weight of your baby. But even that can sometimes be very difficult. So I think having that community, maybe looking into a postpartum doula can be really helpful, especially if you've got other little ones at home. It's got to be really challenging.
Yeah, that's rough.
Yeah.
And you can see why, when you go through all those layers, why we don't want to lift a baby, bend down to, load the dishwasher, like these little things, as far as like taking care of things in the home, even are kind of a big deal on your body and recovery.
Yes, absolutely. Absolutely. I would say